Okay, now we're moving on to presenting the prime inline data. And for those of you who have ever been involved in an impact evaluation, it's a long slog. You're just starting it, the journey. From the time you actually collect the baseline to the recurrent monitoring work you do, if you do a midline and then an end line, we're talking about patience over 5-6 years of analyzing data, trying to understand whether or not the program is making a difference, trying to talk your donors into waiting till we get the data analyzed before you pull the plug. All of these are important considerations because this stuff is a long slog. And so when Tiffany said we finally had an end line, that was a big deal. That is a big deal because so many projects that start up these impact evaluations never complete them. So we're proud to present these findings to you now from the prime and the preg work so that we can learn from it. Now, the other thing that came up in discussions that we had with AID this week was maybe we don't need to do these expensive, big impact evaluations everywhere that we work. What is more important is to take opportunities to learn from the ones that we've already done, maybe start them in new contexts where we don't have a lot of information right now, so that we can learn in that setting, and then look for more cost-effective ways to collect the kind of information that allows us to make better decisions going forward. So I'm not trying to be an advocate that everywhere we work that we should do these big, expensive impact evaluations. We should take advantage of the ones that we've already done, learn from those, and then be a little bit more effective and nimble going forward. So the PRIME project, and I'm preaching to the converted because Diana was one of the M&E people on the PRIME project. But the goal was to reduce poverty and hunger by enhancing resilience to climate change through market linkages. And so it had 3 IRs. One IR was to improve productivity and competitiveness of livestock and livestock products. The second IR was more focused on enhancing pastoral adaptation to climate change. The third IR was to strengthen alternative livelihoods for household transitioning out of pastoralism. There was also an IR focused on M&E and one that was more on nutrition related. I'm not going to be talking about those other ones. But the key thing about the PRIME program was that it was an integrated approach. It was trying to strengthen multiple systems simultaneously to achieve the best results. So the PRIME project, and these are some of the main takeaways that you need to have going forward, is that it was trying to work in areas that were exposed to extreme shocks. This area of Ethiopia was nailed by 3 droughts in a row. 3 droughts that were kind of like 50, 100-year droughts. So trying to have any kind of positive impact in that kind of environment is a major accomplishment. But they did have a positive impact on the households in that environment. And it was brought about by this comprehensive resilience programming. They were addressing these multiple systems simultaneously, and they were trying to strengthen a number of resilience capacities, everything from social capital to livelihood diversity to market access at the same time. Now you're going to see, this gets back to your question, Andre, about connecting interventions to actual building capacities. And we're going to see how that worked here. So in this presentation that I'm about to make, I'm going to first talk about the methods that we use, then I'm going to talk about the background on shocks and coping strategies and trends in food security, then I'm going to talk about the impact evaluation results, then I'm going to talk about the implications of those results for programming and future research that we think should be done from it. Those of you who have trouble sleeping, the full report will be made available next week. It's over 250 pages, but there's a lot in there, and I think if you are an impact wonk, you'll like this stuff. Okay, so I'm just pointing that out to you that it will be available next week. So we were trying to determine whether the PRIME project was actually building resilience to shocks and building up capacities to help manage shocks. So when we talk about resilience capacities, we talk about three types of resilience capacities. We talk about absorptive capacities. This is enabling people to minimize the exposure to shocks and recover quickly if they are exposed. A lot of the DRR work that you guys do is under that. Building savings groups is under that. Bonding social capital is under that. Adaptive capacity. This is where people know that climate change is happening and they make proactive and informed choices for alternative livelihood in those changed conditions. And then transformative capacity, these are the enabling conditions, these systems-wide changes that need to be brought about to allow the people's communities and households' absorptive and adaptive capacity to be better. I'm not going to go through this framework, but essentially all those components are represented in this framework. You need to have some kind of pre-shock measure of all these capacities, the food security outcome measures before all these shocks hit. We need to have some measure of shocks and stresses. You need to have data collected on these capacities. You need to know what their coping strategies are and how they're doing after the shock. So the realized resilience, are they resilient or not? So the PRIME project had 3 research questions. This impact evaluation had 3 research questions. Did households' engagement in resilience strengthening interventions increase their resilience to shocks and their resilience capacities? Which specific resilience capacities were strengthened due to certain household engagement in different interventions? And which types of interventions enhanced household resilience and resilience capacities? So this gets directly at what Andre was asking about. So these are the regions that in the PRIME project that we actually did the impact evaluation. The project was actually also operating in a farm, but we didn't have enough money to do all 3 regions. So that's another thing that's important to understand is you may want to do an impact evaluation over the whole program, but you don't have enough resources to do that. But we were able to analyze the differences between Jijiga and Borana, which were very contextually different. So, on the methods, we had subjective and objective measures for capturing resilience. So from our perspective, an operational definition of this is the ability to recover from these shocks or at least maintain your food security in the face of those shocks. So our main food security indicator that we were tracking was the household food insecurity access scale, but it was the inverse. And what we mean by the inverse is if you know that scale, the higher the number, the worse you're doing. So when you turn the inverse, the better you're doing, you should be able to, anyway, you understand what I mean. And then we also were interested in self-reported ability to recover. And what we did was we asked about every shock that people were exposed to, do you think you can recover from this? And we were interested in what the effect of that shock was. So we were trying to capture the severity of the shock as well as people's ability to recover from that shock. And we created a shock index that we could then hold for so that if you know that people are exposed to different levels of severity, you want to know that when you're trying to determine whether your intervention is making a difference. I'm not going to read all of these different capacities, but those of you who are interested, you can find these both in the briefs and in the main reports. But we looked at a number of different capacities under these different things, different absorptive capacities, adaptive capacities, transformative capacities. And we created indices around each of these using factor analysis. The other thing about an impact evaluation is you need a treatment and a control group. So the treatment group receives more of the interventions. The control group receives fewer interventions. What we were trying to do was look at intensity, because one of the hypotheses was if you have more comprehensive resilience programming going on in the area, where you have multiple interventions, that should bring about a bigger impact than if you only have 1 or maybe 2 activities going on. We couldn't do an RCT in that area because it was such a comprehensive program. It was no way to prevent some households or communities from getting access to some things. So there was no way to hold for that. And actually, we thought that was a little bit unethical to do that too. So we did use propensity score matching to match up the households, so that the treatment group and the control group matched up almost perfectly at the beginning of the baseline. And these are the kinds of indicators that we used for matching them up. We wanted to make sure they were at the same level of food security, they had the same levels of resilience capacities, they had the same social demographic characteristics, they had the same asset, they had, what was the women's decision-making power in the household, what were serious time constraints that they were facing, what were the village characteristics to take into account, what kinds of government programs were they exposed to, what kinds of NGO programs were they exposed to. So we were able to hold for all of these factors when we were comparing these households, so they could essentially be the same at the start of the project. Now we also used panel data. So one of the things that allowed us to do was it allowed us to be much more rigorous in our difference of difference calculations. The thing is, when you match up households through this propensity score matching, and you can also, because it's the same household you're comparing over time, what happens is some of these more cultural traditions or things that are hard to actually capture are held in constant because it's the same household. So, what it does is it allows us to really look at whether the difference is made by the project or not. So, most of the interventions that Prime was implementing were at the systems level. Okay, they were trying to change things in a big way, not in just household by household. They were trying to create opportunities for new markets. They were trying to create opportunities for different pasture management going on, access to water in a large pastoral area. So the thing is that people were exposed to a lot of these systems changes, but it didn't mean that they participated in the systems change. Okay, so we were interested in two levels of engagement. Were they exposed to these systems change, and did that make any difference? So if they did put a new veterinary service in a place, or they did improve the rangeland in an area, did people benefit from that, even though they didn't actually participate in the rangeland management? And what happens when they actually did participate, where they actually used the veterinary services, or where they actually did engage in the rangeland management activities? So the kinds of interventions that Prime was trying to implement around livestock productivity and competitiveness, they were providing veterinary pharmacies, they had community animal health workers that were trained up and working in the area, they had commercial animal feed and fodder available, they supported milk processing establishments, they provided information dissemination, both animal health and feeding, livestock market prices. So they provided a lot of information to people. The pastoral natural resource management cluster of interventions focused on community natural resource mapping, natural resource management planning, improvements in water sources for animals, rangeland management, grazing land user groups, and information dissemination as well. The financial services that they were investing in looked at VSLAs, created VSLAs, Rusacos. They also had mobile banking services that were put in place called Hello Cash, and other information dissemination through opportunities for borrowing money, for example, now that financial services are available. And then they had some climate change adaptation work that they were doing. They had a lot of disaster planning, response programs. They had shock planning with regards to what to do with your animals when a drought hits. They had better information dissemination around seasonal rainfall forecasts, pasture conditions, water availability, heat stress. Okay, so when you look at the cluster of interventions that they were trying to implement, we basically found that this comprehensive resilience programming made a big difference. In other words, if you engaged in 3 out of 4 of these cluster of interventions, you were more likely to be more resilient than if you only engaged in 1. And so 44% of the Prime households were exposed to these comprehensive resilience programs. 30% directly participated in these programs. So we did a baseline in 2013. We did an end line in 2017. We also had 2 rounds of recurrent monitoring in those off years. we had a lot of qualitative data being collected at each of these rounds. And so the qualitative data was really important because it allowed us to understand the quantitative data better. It also allowed us to understand what was going on in the communities on the ground. It helped us interpret the data, and it gave voice to the local people. So what was really important was hearing people say things in their own words as to how these conditions were changing, how they were adapting to these conditions, what were the key factors that were important. And one of the things I want to say that we learned from this is that, you know, FuseNet and other early warning systems have a number of indicators that they're tracking. But what we found was that there were very context-specific thresholds in these areas that were key. If you understood these thresholds, you would know that's when you have a crisis modifier that actually is used, or that's when your contingency plan, if you're in the PSNP program, actually gets used. These thresholds are things like when the village headman is there, and this is in Barana, for example, when the village headman is there, he makes sure that the informal safety nets are functioning effectively. Everybody that's got a few extra cows or a few extra resources redistributes it to other people that are maybe aged or widowed or have too many kids that can't take care of them. So he makes sure that everybody is taken care of. But when conditions worsen to the point where he has to move with his animals out of the area to new pasture areas, that informal safety net breaks down. There's nobody that tries to make sure that everybody is redistributing anymore. And when that breaks down, that's one of those big thresholds where people can tell you when they got really worse off at that moment when the guy left town. And so we need to understand these kind of cultural practices a little bit better as key triggers for when you need to intervene. So in terms of shocks, like I said before, this area was hammered by droughts. Rainfall deficits were the highest since 1950. You had extreme dry soil moisture conditions. It was extreme droughts in both areas, but it was even worse in the Barana area. So what was interesting when you compare the baseline to the RMSs to the end line, at the beginning, before these droughts hit, the Barana were much more resilient than the folks up in Jijiga. They were a lot more pastoralist groups. They were more mobile. They were able to manage these shocks a little bit better. But once they got hammered by these droughts over and over and over again, the Barana got worse off over time. And the people in Jijiga that were able to diversify, because they were closer to towns, they had livelihood activities that were not ag-based. They were able to be in a different risk environment in terms of their ability to make money. And they actually became a little bit better off as a result of the project than the folks in the Barana. This just illustrates how bad the rainfall conditions and the soil moisture conditions were. And the blue line is Barana and the red line is Jijiga. Both areas were badly hit, but Barana was hit much worse over the time frame of the project. So from the qualitative work, we get these kinds of statements. You know, people, in the first drought that they were exposed to, this was the drought in 2015, they were losing their cattle, but they were still able to manage the shocks because they were able to turn to certain capacities like social capital and other things, selling off some assets. They were able to manage it. But when the second drought hit and there was no rain to even get any stubble in the fields to feed their animals, that's when it really got bad. And that's when all these, you see these CNN moments where this mass die-off of animals happening. The other thing I mentioned before is that we need to be aware of the downstream effects. Drought was serious, but it had all kinds of effects later on. So, for example, when you don't have enough fodder and water for your animals, livestock disease starts to break out. And so people are trying to sell all their animals before they die. So you get this huge influx of animals going into the market. Prices in the market drop dramatically. So the terms of trade for crops go way down. And so people then you know, you can't do too much. So what they do then is they start migrating. They migrate into other ethnic group areas, and then conflict goes up by 20%. So, you know, it's not just the drought that hits, it's all of these downstream effects that you need to be aware of. So the downstream effect of the drought is animal disease, then a market shock, and then a conflict shock. So these are connected to each other. People, you know, they try to cope. So one of the first things they do is they reduce their food consumption. They keep trying to share stuff. They sell livestock. Again, that's a tricky one to look at in terms of livestock sales. But when they start turning to really negative coping strategies, like dropping their kids out of school, they're affecting their long-term human capital investment. So kids are forced to go to work, or they migrate they send their kids off to other places. What we also found as the drought conditions got worse and these other downstream effects got worse, we saw a lot more gender violence happening in these communities. And so divorce rates went up dramatically. Women were being forced to spend more time looking for water and fodder and wood for their homes, and so they were gone 3, 4, 5 hours a day, and that created more conflict because the husband was upset that they weren't there to actually make food. So these conflicts really got severe in many of these communities. A lot of youth were migrating out too. Mercy Corps actually understood this, and part of their intervention strategies was actually to try to create opportunities for when the youth do migrate to urban areas, that they don't just show up, that they actually have some skills that they can apply when they get there. But we saw a lot of increase in wage labor, dependence on wage labor and petty trade, and if too many people are competing for the same jobs, you can imagine what happens to the wage. It goes way down and then becomes more difficult to actually support. Humanitarian assistance also starts to go up. We're starting, more and more households are relying on food for work, cash for work, or direct distribution of food. And that became an important way to actually survive this. But a lot of this humanitarian assistance came too late. You know, it's really important that we try to understand resilience can reduce the need for humanitarian assistance, but good resilience programming also recognizes when humanitarian assistance needs to be launched, for how long, at what duration, and how much. If we're going to save the investments that we actually are making, we need to be able to make sure that we don't just reduce the need. I mean, that's great if we can do that, but we also are smarter in the way that we actually do provide that humanitarian support. And Mercy Corps was becoming very innovative in their crisis modifiers. They were trying all kinds of things, you know, but they were getting better. You know, there were a lot of logistics you had to get in place to be able to actually release these resources in a timely fashion. So contracts had to be actually lined up ahead of time. You know, the first year that they were trying to do it, it was a nightmare because AID was not flexible enough in its own, you know, what do you call it? Its own bureaucracy with regards to who gets a contract or not. They were late. They were too late in the first distribution of resources. So things got bad in these areas. Not so bad in Jijiga, but it really tanked in Borana. So what we see is severe food insecurity doubled in Borana over the course of this evaluation. Whereas in Jijiga, it kind of leveled off. And that's because Borana, the severity of the drought hitting Borana was so great that it really, you know, no matter what people were doing, it just wasn't having much of an effect. So what do the impact results tell us? Both exposure and participation in these comprehensive resilience programs does strengthen households' resilience to shocks. Direct participation had a much greater impact than only exposure. So households that were just exposed to these systems level changes had an 18% lower decline in their food security than those that weren't exposed. And those households that actually participated in these comprehensive resilience programming had a 40% lower decline in their food security. So it made a difference. both just having the system in place, but also participating in those programs. What's also been interesting about this is that it had a strong preventative effect on severe food security. The end-line prevalence was 56.5% because of the Comprehensive Resilience Program. It rose to 72.1% for households that were not engaged in these comprehensive resilience programs. That's really high. So when you do propensity score matching and you're trying to compare your treatment against your control, those of you statistical wonks, this is the average treatment effect of the treated. That's what ATT stands for. It's not a phone company. But what we can see here is that even though both are declining, the treatment group declined less when you're exposed, but also decline much less if you're participating. These are both significant differences. In terms of actual impact of participation in these comprehensive resilience programming, we see that Jijiga really, it went up in terms of positive gains with regards to this resilience. So the impact on resilience was much, even though it was stronger in Brana, and what we mean by that, it was bigger this way, you were still going down. Again, it's because of the severity of the drought. So we have to factor that in whenever we're looking at these resilience results. But what really is interesting is this one. We see that households that were actually exposed to these comprehensive resilience programs are much more able to manage these shocks than those that are not exposed. And so we see a huge decline in food security for people not engaged in these comprehensive resilience programs, but those that are engaged, we see a positive gain in household food security. So talking to people in the community again, before I got support from the PRIME project, my land wasn't suitable for planting anything. But due to the training I received, everything changed. Now, one of the things that we were also interested in this impact evaluation was engaging in this comprehensive resilience programming. How did it affect these three types of resilience capacities that I mentioned earlier, absorptive, adaptive, and transformative capacity? What we found was if you engaged in this comprehensive resilience program, you increased in terms of strengthening resilience capacities. If you didn't engage, you saw a decrease in resilience capacities. So in the absence of the engagement in a comprehensive resilience program, households' resilience capacities would have declined even more due to the drought. So there were 20 capacities that were actually positively affected by these interventions. One of the reasons why we want to pull out the components separately from the actual indexes themselves is that's where your real policy levers are. You want to know what kinds of interventions you want to actually engage in that will have a positive way of strengthening these capacities. What we found was the comprehensive resilience programming improved access to informal safety nets. It had improved people's availability of hazard insurance, disaster preparedness and mitigation, and asset ownership. All of these capacities increased significantly as a result of participating in these programs. 7 adaptive capacities were strengthened as a result of these programs. Bridging social capital, aspirations and confidence to adapt, livelihood diversity, access to financial services, human capital, exposure to information, and asset ownership, all increased as a result of these comprehensive resilience programming. Now, one of the things that is true and dear to Tiffany's heart is, and mine too, actually, I'm really interested in trying to figure out what the project was doing to increase people's aspirations. And we need to get a good handle on that, because we know that if people feel that they have competence to adapt, that they have control over their lives, that they actually they feel empowered to do something, those are people that are more likely to be resilient in the long run. Much of the psychology work that Tiffany's been involved in actually comes out very strongly on that. So one of the things, talking in the future to prime folks, whoever gets the next one, to try to make sure that they try to understand what they're doing that actually improves on this. And then finally, in terms of transformative capacity, because this project was working more at the systems level, bridging social capital, access to markets, access to livestock services, access to infrastructure, and access to formal safety nets, all of these things were strengthened because of this program. Okay, let's talk about the impact. Now, the livestock productivity interventions had a positive impact on resilience. So did the climate change adaptation interventions, those cluster of interventions. The financial services one, we don't see a lot of impact yet. This comes back to something I stated earlier. You can have a systems level change, but it may take a while before it actually shows up as making a difference. And you put in financial services, it takes a while for everybody starts to engage in it. Maybe in 2 years, it will make a big difference. But the other thing that's important here, the pastoral natural resource management interventions had a mixed effect. It was negative and positive. Why do you think it was negative?
Lack of engagement.
Huh?
Probably lack of engagement.
Lack of engagement, that's a good point.
Clan affiliation.
What's that?
Clan affiliation.
Maybe. One of the things, if you remember, when governments kind of block off an area and say, okay, you can't use this pasture anymore, or you can't use this water source anymore, it can have an immediate negative effect on the households that were using that pasture and water. Okay? But if I'm participating in that management activity, it can have a positive effect on me. Okay? So this intervention is it's that we need to understand what the effect of putting enclosures in, preventing people from having access to something, what effect that has on those populations. Okay, so the do no harm principle is something that we want to take seriously going forward, and this is a lesson learned. John was asking for some of the negative stuff. This is one of them. This is something that we learned. But the thing about these different clusters of interventions, the livestock productivity, the financial services, and the climate adaptation stuff, all had positive impacts on these sets of resilience capacities. The other thing that's important is we were interested in which capacities were strengthened by by these interventions, and the livestock productivity interventions strengthened the most capacities. If you go out at the break and look at these infographics that are out there, you can actually see you'll see all these really cool looking arrows, and the ones coming off the livestock productivity one shows that it strengthens so many different capacities. Whereas some of the financial services, the climate change adaptation, and the pastoral natural resource management stuff didn't strengthen as many. But the magnitude of the impact, financial services, in terms of changing these capacities the most. So it's important to understand that it's not just the number of capacities that you're having a positive influence on, but how much strength of an impact are you having on those capacities. So when you do your analysis, you want to look at both of those. Okay, what are the implications of all this? Well, number one, which is a takeaway that you definitely would know already, is that implementing comprehensive resilience programming seems to work. It's something you want to encourage, that you want to do. That direct implementation in interventions has a greater impact than just putting of systems in place. So systems level interventions are important, but getting people to actually use those systems is important. That different intervention sets or clusters have different impacts. So you want to leverage those clusters that are likely to have a bigger impact than those that don't. The other thing that we learned was that these interventions had a positive impact on a number of different resilience capacities, many of which are not economic related. Okay, so it's not just the assets, the access to financial services, but it's also social capital, people's aspirations, the human capital side, access to safety nets. You know, all of these capacities are important. So if we recognize that shocks are not going to go away, especially in these areas that we work in, you don't want to have all your eggs in one or two capacities. You want to have multiple capacities that are strengthened because there's a sequence in the way people use these capacities. And these RMSs that we've done actually show which ones they start to implement first, which ones they implement second, which ones they implement third, you know, because in the end you want to know, like, okay, I really strengthened social capital, they should be able to buffer things for a while, but they'll use all that social capital up. What else can they turn to now? So recognizing that people, over time, they use different sets of capacities to manage these downstream effects. The other thing that I already mentioned is that we want to avoid the negative impact of some of our interventions. If we know, you know, this is really classic, you know, the government will say, okay, we're going to protect these natural resources, we're going to build these enclosures, all these farmers and pastoralists who are using those enclosures can't have access to them anymore. Well, yeah, we protected all the species in that enclosure, but you actually made people worse off as a result. So we need to make sure that we understand active participation of people in those natural resource management activities are going to make the difference. You can't just block people from access, you have to engage people in that. The other thing that was important is that the project was implementing different types of interventions in different locations. And what we found was if you emphasize maybe the natural resource ones more in the Barana region and all the livestock productivity ones in the Jijiga one, maybe that's a big difference why Jijiga did so much better than the Barana. So trying to understand where you're targeting your interventions and once you know that these interventions have different effects, recognize that maybe we need adaptive management here. We could reallocate our thinking around this, put some of those other things in other places. Now, I know that the enabling conditions in Barana and Jijiga were totally different. You had better access to markets in Jijiga, you had better, more urban areas, et cetera. And that's important to factor into this. But I'm just trying to say that when we looked at the intensity of these interventions across these locations, there was a difference in which clusters were concentrated in which areas. The other thing that I already mentioned this when we were talking about recurrent monitoring and how important recurrent monitoring is to feed into adaptive management. We could have used the recurrent monitoring that we were doing better to help the PRIME project actually do better adaptive management. If we would have picked up on the fact that these productivity interventions were having a bigger effect in one location than the other, that's kind of dialogue that we should be having with the project and saying, hey, you know, maybe we should rethink the way we're targeting this stuff. The other thing that came out of the qualitative stuff that we didn't capture in the quantitative stuff was that there was a problem in the safety nets, the formal safety nets, the PS&P program that was being implemented there. And so the mission realized they probably need to provide more technical support to the government on getting those productive safety net activities working better in those regions. Also, from the qualitative work, we found that access to markets, particularly market mobility on the part of pastoralists, could be improved. And that we needed to recognize that there's other things we could be doing to make those markets more accessible to the pastoralists. And then I already mentioned this issue about wasting in Jijiga actually getting worse, even though food security went up. So understanding, you know, we are comprehensive, but maybe we should have been thinking about healthcare and access to water a little bit more in these intervention sets that we were actually implementing, not to be only focused on livelihoods. Questions and answers.